Okay, good afternoon, everyone. I hope you can all hear me. My name is John Byrne. I'm the Medical Director at Humber Teaching NHS Foundation Trust, but I'm also the Senior Responsible Owner for the Yorkshire and Humber Care Record. Delighted that so many of you can join us today on the webinar. And I'm joined by my colleagues today. I've got, in no particular order, but I've got Richard Gladman, Monica Jones, we don't actually have Kuldeep and Professor Hall, but we actually have some videos of them which are equally as good. I am mindful that you're all really busy people. You've probably spent the last 6 or 7 months staring at screens and webinars. So we're going to endeavour today to keep this as interesting as we possibly can, bearing in mind there is some element of technical data in this, but actually we're going to sort of hopefully get to the opportunity to interact with you as we go along. So if we'll just move on to the next slide there, please. So this is just the agenda that we've got. Just want to point out we are absolutely going to have a break in here. And we're going to dispense with the normal NHS tradition of just giving you 5 minutes, which really isn't enough time to go to the loo, let alone have a drink. And hopefully we can sort of stretch this out to 10 minutes, so we really can get off our desks and have a decent break. But this is the agenda that we've got here. I'm just going to go through some introductions, and then I'll pass you over to my beautiful assistants as we go through the session, as we give you a bit of an update on the care record, population health management, what it actually means in reality. Is it something you can feel or touch or use? A little bit of a view from the front end, in other words, the people at the sharp end, about how they're actually using it, and then we'll have some Population Health Academy work experiences from Monica later on. So we'll move on to the next slide. Okay, so I have been told that I'm under strict instructions to deliver this set of slides within 10 minutes, and I'm mindful I've already used up 2 minutes, but we are going to sort of send out all the slides to you today. So what we're not going to do is put up slides and read them through point by point by point, because it's the sort of stuff that drives us mad, so we suspect it drives you mad. However, just a couple of things to say. We're really proud of what we've managed to achieve so far. And the key thing for us is that we all collectively remember that this is an NHS-owned solution. Now, I'm mindful that we do have colleagues on from local government on the call and social care. So when we use the phrase that the NHS owns this solution, actually we were thinking more broadly than this. But actually, this is a project which is absolutely rooted in the public sector. Now, the key thing I want to talk about in the few minutes that I've got with you is around Joined Up Yorkshire and Humber, which was the engagement process that we ran right at the start of the programme. Now, I don't know about you, but I feel really strongly that I want my data to be kept safely, I want it to be used appropriately, and I want it to be used with good intent. And funny enough, my views are pretty much the views of the people and the citizens that we live with in the Yorkshire and Humber, because we went out and we thought it was important to seek their views, particularly in the current context with regard to data and population health. So we'll just move on to the next slide. So what did we do? Well, look, we did, we got some experts in, they knew what they were doing. We ran some workshops, did some qualitative insight gathering, and then we did some online surveys. And we genuinely wanted to explore not what technical people thought, not necessarily what clinicians thought, but what we collectively thought with regard to how we should use data. So we'll just move on to the next slide. So what did people tell us? Well, funnily enough, and it's probably no great surprise to you, but 95% or the majority of people supported the use of data. As you could imagine, there was a significant distrust with regard to commercial research, and we could talk all day about what is commercial research and what is not commercial research. But nevertheless, there was a strong support for public health use, such as screening and health advice. But the public are adamant about not selling the data to private companies and making sure that the data was stored securely, and likewise that there was no malintent in terms of using data to cut services. So you can understand in the general public, and sometimes the way we feel ourselves, that actually there'll be a little bit of cynicism with regard to data, but it was really important for us to understand this data right at the start. However, you'll all be aware of the fact that when you go to your own GP or you go to ED, you have to answer all the questions again and again and again and again and again. And we all ask each other, why don't you already know the answer to that? And the reason for some of that is that we haven't shared the data in the first place. So Richard will talk a little bit more about the programme, and I don't want to steal his thunder, but actually this is about getting the right care to the right people at the right time and reducing the collective frustration, whether you're a citizen, whether you're a patient, or actually whether you're a member of NHS care staff or social care staff. So we'll just move on to the next slide. So that's how we sort the people want very short, clear and simple explanations. Actually, I'm from a professional background and I'm with them as well. I don't like acronyms and I don't really like some of the jargon that we use. So keeping it simple and stupid is good for me, and it's actually something which the team believe in too. Always good to remind ourselves that the people trust the NHS more than other public services. I think we just need to be careful there. People absolutely trust our colleagues in social care too. So I'm just mindful that I don't want to cause any offence with saying that people trust us more than anybody else. But I think you know where you're coming from. I'm not so sure people trust the folk who come along and put tickets on your cars in the car parks. And in some places they would be public servants. But hey ho, moving on. Interestingly, younger people have more trust than older people, and that's an interesting thing. Is that based on trust or is that based on naivety? And we could explore that all day long, but we won't. People wanted to understand and have an explanation of what population health management was, and we were happy to do that. But they're really concerned about data security, data breaching and hacking. And you know what, if you're not worried about data security, you're probably not on the right webinar. And I know you will all be worried about data security, breaching and hacking. As we go through the session, we will deal with some of the technical issues about how we assure ourselves that we're getting this important and crucial piece of work right, because if we drop the ball in this, we understand that we're placing our programme in jeopardy, and also that the data should be up to date and accurate. So moving on, we co-produced and tested some explanations, and this is what the population said they were comfortable with in terms of describing data security and privacy, and also what do we mean by population health management. So as I said, we co-produced and tested these terms with the people that we work with and live with. Okay, a little case study here, which is just useful just to think about. At the end of the day, we're doing all of this because it matters whether it's Emily who's aged 5 or whether it's Emily who's aged 80. It's important that we get this data right, but also that we tell people the story of what we're trying to do and why. And I think I've just got inside the 10 minutes before the big shepherd's crook comes along and takes me off the screen. So we will move swiftly on to our next beautiful assistant, who in this case is Richard Gladman. So I'll let Richard introduce himself and I'll try not to steal any more of his thunder. Over to you, Richard.